So the whole driving force between the colleges to really increase collaboration. So as I talked about, interprofessional collaboration where people with different backgrounds get to work together. That's exactly what happens in a clinical setting, whether it's nurses, social workers, respiratory therapists. They have the opportunity now to work much more closely together. And also because they share so many kind of pedagogies and resources, it should increase efficiency as well because they can share those resources much more easily. They're all under one unit than if they're spread across the campus in different schools. So we really see that as being a boon. The other really big thing is that it gives an identity to those programs which are so important to our campus. It'll be the largest school, and yet they were spread across campus, in different schools, not easy to identify. So for example, if you wanted to know more about healthcare programming at SU, it'd be really easy for you to find somebody to talk to. Where now you kind of have to fish around and look down at the department level.
So with this changing structure, obviously you said these programs exist, but right now under different colleges.
Yep.
So with that change, will the programs themselves expand?
Yep. So we're hoping that through this collaboration and increased efficiency, we'll be able to support the number of students that we can admit and take in. So that's certainly a goal. And then also for opportunities to grow additional programs or additional collaborations is certainly a goal. I think that's right.
And then as students get closer to graduation, how will them coming out of the College of Health and Human Services instead of the previous colleges help them when they're applying for jobs?
So certainly for student recruitment as well as for their marketability upon graduation. Frankly, healthcare students don't have trouble getting jobs if they did well in their programs because they're in such high demand. But in terms of our ability to recruit excellent students, it's a lot easier to recruit not only students but faculty into a College of Health and Human Services. Just as an example, if you look around Maryland, we have really arguably the best nursing program in the state, and yet it's a department of nursing, where every other nursing program that's comparable, or at a four-year institution like our own, is in a school of nursing, a college of nursing, college of healthcare. They aren't departments within a much larger structure. So we really think it'll allow the faculty recruitment to be enhanced as well.
And then last question for you, now that this has been announced, what is SU doing now to move this forward and open it in the fall?
So to open in the fall, it's kind of a little bit wonky type stuff in terms of making sure that behind the scenes and our student data systems and all that work, students that are coming in the fall are actually tracking into this college and our databases. The faculty are working really closely together. Now with the new School of Health Sciences, for example, that's a whole bunch of people that haven't worked together before, so they're doing that. They're establishing an office of the dean that'll be in Conway Hall, and then moving some faculty around to kind of put them in closer proximity to each other so they can work more closely together. Familiarizing everybody with some of the resources like the Simulation Center. That's all on tap for this spring.